Fighting this disease will take time. Before this is over, we may see more isolated cases here in America. But we know how to wage this fight.
President Obama on Saturday trying to reassure Americans who may not be all that confident in the government's response to the Ebola threat. And it's time now for our Sunday group. Britt Hume, Fox News senior political analyst. Neera Tanden, president of the Center for American Progress. Syndicated columnist George Will and Fox News political analyst Juan Williams. Well, I want to start with the lead story in the New York Times on Saturday. Put this headline up, if you will. The headline, amid assurances on Ebola, Obama is said to seethe. I haven't seen the word seethe in a headline in a long time. The story goes on to report that the president is just as upset with the administration's response as all the rest of us. Britt, do you buy it?
No. The story, I felt bad for the administration, and I felt worse for the New York Times when I read the story. I didn't buy it at all. This was the president's aides, most of them anonymous, portraying him as having all this empathy with the public about all this. Seething, absolutely. I didn't believe it. And I would say that I think the appointment of Ron Klain shows you the administration thinks this is more of a political and public relations problem than it is a public health problem. It is clearly both. And the key to the whole thing, Chris, in my view, is that Klain was not given the kind of authority, in other words, reporting directly to the president and taking overall charge of this effort that someone who is a true czar would. What, in fact, he's doing, he's still reporting to people that have been managing this problem already.
Neera, I want to go bigger than Ron Klain. As the head of a think tank that has close ties to the White House, how do you explain all of the screw-ups in the government response to the Ebola situation here in the U.S. so far?
Well, look, I think it's clear that CDC gave, some inaccurate protocol information right at the beginning of this. They even said so on Thursday in the New York Times that the protocol should have been closer to Doctors Without Borders. I do think that the administration is taking the right steps. The CDC SWAT teams actually going in wherever there's a patient immediately. That's an important step. The steps that are taking now are really critical. But I do think we should put them...
Not to relitigate, but you had, and we played this for Dr. Fauci, Frieden saying we can stop this in its tracks. Lisa Monaco saying every hospital in this country knows how to isolate. President Obama talking about I'm hugging nurses. I mean, there was a statement of, there was an overstatement and over-certainty that just really, I think, has hurt the government's credibility.
Look, I think actually Dr. Fauci answered these things very well, and I think it's important that Dr. Fauci is out because these are actually public health issues, and I think the challenge here, I think he said very clearly, look, we have 3 cases so far, 300 million people, 3 cases. We don't want to institute panic in the country. We now see instances of some overreaction in the public. We want to get to these cases. There should have been CDC SWAT teams every single location.
Would you have felt good if you were on that plane with the woman that was told by the CDC to fly when it turned out that she had Ebola?
I wouldn't feel great about it, but on the other hand, I don't think it's right now for the media to instill a level of panic in the country that can lead to counterproductive results. We want people who are sick to come forward, and we think this is a public health issue, it shouldn't be a political crisis. It is a public health issue.
Fair enough. George, we spoke yesterday, and you said you wanted to focus on some comments that Tom Frieden, the head of CDC, made. This was about a video that President Obama sent to the hot zone in which he said, you can get on a bus and you don't have to worry about catching Ebola. Frieden was asked about that. Here's what he had to say.
If you're a member of the traveling public and are healthy, should you be worried that you might have gotten it by sitting next to someone? And the answer is no. Second, if you are sick and you may have Ebola, should you get on a bus? And the answer to that is also no. You might become ill. You might have a problem that exposes someone around you.
George, you say that's the problem.
Well, that is the problem. If you're now feeling healthy, you're going to go on feeling healthy because you can't get Ebola sitting next to someone. But if you have flu-like symptoms or Ebola-like symptoms, don't get on the bus because you might expose someone. You can't square that circle. The problem is the original assumption was, said with great certitude, if not certainty, was that you need to have direct contact, meaning with bodily fluids from someone because it's not airborne. There are now doctors who are saying we're not so sure that it can't be in some senses transmitted by airborne.
I'm not sure that's true.
Not, where are you getting the doctors who are saying that it's not airborne? I mean, we've had CDC, we've had the World Health Organization. Doctors have been treating this for 40 years. It's not just like Ebola just started. Where are the doctors? You had Dr. Osterholm here too, who is basically not critical of some elements of this, but he's also saying there's basic facts around this.
Well, among the basic facts are that those who said that it's not airborne, you must, however, understand they said that the fluids can be infectious for up to a number of days.
Yes, but you have to have interaction with fluids.
On a dry surface. Hence, they said, well, when you get on an airplane, perhaps you should clean the armrest next to you and the tray. In fact, there are doctors who are saying that in a sneeze or a cough, some of the airborne particles can be infectious.
I'm sorry, who are the doctors saying? I mean, this is what I think is really important, that facts about this disease do not lead to panic. So far, every expert that I've seen have said
every
that
expert that you've seen. Here we go
World
again.
Health Organizations.
Here we go again with people saying,
well,
everyone agrees.
I do want to say this, though, in the interest that there is no indication so far that it is airborne, that yes, if there's fluid and you're a couple of feet away, it can have an impact, but it isn't that you can just breathe the air.
But isn't that airborne?
Well, no, it's contact with the fluid. It's different than the flu.
Yes,
it's different than the flu.
Yes, it's different from the flu.
We do want to stay with what we know, and we don't know anything to contradict that. Let me just quickly go to you in the time we have remaining, Juan, because we asked you for questions for the panel, and we got a number like this from Clay Dalton, who writes, a lawyer with zero medical experience. He's reacting to Ron Klain. As usual, I have no confidence in the government. Juan, how do you answer Clay, and what about this argument that this does not, the appointment of Ron Klain does not instill more public confidence, particularly when our public health experts have said a lot of things that turned out not to be true?
Well, I don't think there's any question, given the way the networks are running around doing their Chicken Little routines, trying to, pump up ratings.
It's all our fault?
I think the media's been terrible on this story. I got to tell you something, just irresponsible. But let me go beyond that and say, the Congress had hearings this week. The political curtain has gone up on this theater. And I think Ron Klain is part of it. I think it's a political response. Did not please me. I thought we needed somebody with more expertise on the specific issue. But then again, the White House has come back and they've said, you know what, this is management. This guy knows how not only to manage, but to coordinate, to implement, make sure everybody has right supplies, not only here in the United States, but also in Africa, the military. So all of that to me is important, but what you see is the politics now come to the forefront. The Republicans are using it to try to undercut the president. He's incompetent, other instances of incompetence. The Democrats are now shifting and rushing as we approach the midterms. To me, this is all politics, and it's just so disconcerting when you think it's a human situation. There's going to be human error, but we're trying to deal with it. Honestly, America's the only country doing anything. I don't see the Europeans, the Africans doing anything, and yet that people are like, oh, Chicken Little, sky is falling. This is craziness. It's sad.
All right.